Sorry about that. Okay, so like I was saying, steroids, you need to wean them off slowly because of the rebound effect can be really life-threatening on the adrenal glands and everything like that. So be really careful weaning people off steroids. Again, I am on page 1602. I am talking about inflammatory bowel disease. So ulcerative colitis is eliminated by removal of the entire colon, which is the treatment of choice when surgery is necessary. So just know that approximately 66% of clients with Crohn's disease require surgery, and 40% of these require a second surgery. So a lot of the time, anybody with inflammatory bowel disease, either it's ulcerative colitis or Crohn's disease, will have to get surgery. So nursing considerations, the client who presents with severe symptoms is weak, miserable, and often frightened. Nursing care and medical treatment, including the use of anticholinergic, antidiarrheal, and antispasmodic agents, are used to promote optimal bowel rest. So, on page 1603 is a nice comparison of the two. I'll refer to that. It's really just like a nice little block of everything for you to remember. Okay, let's go on to what's called appendicitis. So appendicitis is an inflammation of the approximately 4-inch of slender blind tube that open off the tip of the cecum. So the appendix may become obstructed by a hard mass of feces with subsequent inflammation, infection, gangrene, and possible perforation. A ruptured appendix is serious because intestinal contents can escape into the abdomen and cause peritonitis or an abscess. Appendicitis is no joke. It's not fun. Somebody presents with lower right quadrant pain. It's usually indication for that. They'll have rebound tenderness, which means you poke it, ow, ow, ow. It's going to be tender. So ultrasound can often diagnose an enlarged appendix. Let's see, here's a treatment. Usually is surgical treatment. Remove the appendix. So a rupture is a serious and possibly fatal complication. Don't mess around. Somebody's complaining of pain, just tell them to go get it checked out. And usually, like, it's bad pain. Like, it's like, it kind of hurts. It's like, no, this really hurts. So that's usually a good reason for them to go get checked out anyways. Okay, so peritonitis is inflammation of the peritoneum, the membrane that lines the abdominal cavity and covers the abdominal organs. Peritonitis usually results from perforation of the intestine or appendix. So again, if that appendix bursts, it can lead to peritonitis from the bowel coming into that. So that could be a really big thing. So peritonitis often develops suddenly. So if that thing ruptures, the appendix ruptures, boom, you're gonna have sudden pain, and then sudden developing of peritonitis. So with severe abdominal pain, nausea and vomiting, a gradual temperature increase, a weak and rapid pulse, low blood pressure, the respirations are shallow because it hurts to breathe. They usually just like in like the fetal position because they're trying to put as less pressure on the abdomen as possible. That's just like a bad sign. So also when you do all like the blood studies and all the imaging, white blood cell counts can be quite high and the client presents as acutely ill. Acutely ill means like sudden onset of an illness. Treatment. Surgery is sometimes necessary. Peritonitis is it's less common today than it ever was because of the education of appendicitis, appendix, and everything like that. So they usually prevent this from happening. Okay, so then we're gonna go on to page 1605, cancer of the small intestine. If cancer does occur in the small intestine, the person's prognosis is usually poor because the disease is difficult to discover in its early stage. So that means when they find it, it's already advanced to quite a bit. The client may have diarrhea, anorexia, nausea, and vomiting. Perforation or obstruction may occur. That's a big bummer. Then you have colorectal cancer. Colorectal cancer includes cancerous growths of the colon, rectum, and appendix. So the other risk factors that go with it, so early detection by colonoscopy is the preferred method. So risk factors, family history, any sort of polyps going on in there, change in bowel habits, rectal bleeding is a big one, a high-fat diet or a low-residue diet. So screening tests are a big thing. So anything with cancer, you're going to have what's called cachexia. So that's the bottom of page 1605 on the left column. So cachexia is general ill health and malnutrition. Basically, cancer just like wipes you out. You just don't feel good. You don't really feel like doing a lot. So that means you're just not going to be eating the right foods or just not feeling up to eating at all. So cachexia is a big sign for any sort of cancer going on in the body. So just know that a lot of time they can just do surgery to get rid of this cancer in the wherever it's at, either in the colon, the appendix, or the rectum. So that's really nice. So just know that the danger of shock after this surgery is great, just due to like the fluid losses and things like that that could happen, just because of vascularity and everything going on around there. So recovery is much faster if the client ambulates soon. However, he or she will require your assistance. So again, a body in motion stays in motion. After any sort of surgery, get them moving and get them going. So then we have disorders of the sigmoid, colon, and rectum. Hemorrhoids. Hemorrhoids are terrible. Basically, they're swollen, varicose veins of the anus or rectum. There's external, which protrude out, and then there's internal, which are inside of the rectum. These are terrible. A lot of the time they're from that pushing when you're going to the bathroom, or just pressure on any of those veins, like usually obesity, pregnancy, chronic constipation, things like that can lead to hemorrhoids, and they can be painful. So usually the external hemorrhoids, they don't bleed, but they may become large, painful, and itchy. So uterine pressure, things like that can cause it. Internal hemorrhoids develop inside the anal sphincter. They may bleed, but are unlikely to be painful if they do not protrude. So, for example, if you see that bright red blood when you're going to the bathroom, it could just be from an internal hemorrhoid, but always investigate any bleeding going on down there. So just that's kind of what's going on with hemorrhoids. The treatment usually is prophylactic, so like sitz baths or the witch hazel compresses, or just like moisture lotion can help with that. Stool softeners can help with like putting less pressure on there, with less like exertion to have that bowel movement. They've also just been in there and done hemorrhoidectomies, which is just like they just take it out, remove it, so, or cauterize it, things like that. So let's see here. So just know like a sitz bath, it can be super like, they can have like a vagal episode, like a syncopal episode where they just like faint because it's so vascular down there, and sometimes that sudden rush of everything can make everything like the sudden rush of like the warm water down there from a sitz bath can make vasodilation happen, and just like like that fainting type feeling can happen. So be careful if your patient's doing one of those. Really educate them on that, and make sure they're in a place where if they do kind of wobble or whatever, that they're like not gonna fall and like hit their head on something or whatever. Let's see here. So just know that because removal of hemorrhoids involves excision of portions of blood vessels, bleeding may and will probably occur. Monitor and document any signs of bleeding, either on the dressings or as indicated by symptoms of faintness, weakness, lowered blood pressure, or other signs of shock. So, and they'll probably need help with that first bowel movement. Stool softeners and foods that just are really easy on the gut are really helpful. So just like don't really give them a lot of like heavy foods. So if defecation has not occurred by the 3rd day of a hemorrhoidectomy, an enema will probably be ordered. Just be careful with enemas. I heard this story one time. This woman was having such bad constipation that they gave her like 3 enemas all at once, and it perforated her bowel. So be really careful with the amount of fluid you're giving somebody an enema. Usually they can take like 50 cc or 500 cc's to like 1,000, no problem. But anything more than that, be really hesitant, because you can and probably might cause damage. So an anal fissure. It's an ulcer on the skin of the anal wall. It causes severe pain on defecation and sometimes slight bleeding. The only care for this condition is surgical removal of the ulcer. So people who have these usually don't like to go to the bathroom because it's painful, which leads to constipation, and we all know about that. So get them seen right away and have them go, just get it removed right away. So then you have an anal abscess. Or a fistula. An anal abscess is caused by infected tissue around the rectal area. An abscess is literally just like a zit full of like bad stuff. So it's just like, it's just not fun. Abscesses are terrible and they're painful. Treatment, surgery is necessary to open the fistula's tract. Medication impregnated with stuff can do the packing. Things like that will help the fistula heal. So the fistula must heal from the inside out, or another abscess will form. Because if you just like heal the top, you're still going to have that pocket and anything collected in that pocket. So you got to heal from the inside out. So, and then with the fistula, it's usually developed as a result of an anal abscess. So just a heads up, those usually go hand in hand if they don't get healed correctly. So, disorders of the liver, big thing in the body. So the liver failure occurs when the liver cells fail to clear toxin. Liver failure occurs when the liver cells fail to clear toxins. So the liver has the ability to repair some of its parenchymal cells, that is, those cells that perform the normal functions of the liver. But if it doesn't, then it's just going to cause big problems in your body. So like I said, you only need about 20 to 30% of it functioning to survive, but you're not going to have a great life. So you just need to help your liver as much as possible. Overdosing on Tylenol, acetaminophen, is a big reason why people have liver failure, because they just don't understand that it can be a big deal. Like one time I had this old lady, she was in so much pain from some sort of abdominal surgery that she was popping Tylenol like crazy, and she came in with liver failure, and she was jaundiced with the yellow skin, yellow sclera. Like it wasn't fun. But I mean, like her body healed and like eventually went away after taking that Tylenol away. So, and then just re-educating her on things. So education is so important. It's a huge thing in the nursing world. Educate your patients about all the things that are going on. So, liver failure is characterized by tremors and mental changes, including seizures, stupor, and coma. Fulminant hepatic failure involves progressive multi-system failure resulting from massive liver cell death. So, diagnosis is made by the LFT, the whole blood panel of the liver function and stuff. So, just know that blood ammonia levels are high in liver failure because the liver cells cannot convert ammonia to urea. Ammonia, a byproduct of protein metabolism, is toxic to the brain. Therefore, you may develop encephalitis, which is just like inflammation of like the brain, and they can't think clearly. So usually they'll be confused and they'll have yellow skin, and you're like, you got liver failure. So treatment of liver failure is symptomatic. So control the bleeding, diet, help them as much as possible. Let's see here. So, and then you have cirrhosis, is a chronic degenerative disease of the parenchymal cells of the liver. So cirrhosis is like the chronic disease of the liver. Let's see here. They basically, since there's so much damage, the cells lose its ability to function very well. So they become, so the hepatocytes, the liver cells, become infiltrated with fatty and fibrous tissue that cannot detoxify body waste. Intrahepatic obstructive jaundice results when hepatocytes are no longer able to function. All body functions eventually deteriorate. So page 1607, everything about the cirrhosis is super interesting, because basically it just leads to like the progression of like liver failure. I don't want to read all of it to you, so read this page 1607 about cirrhosis. It's really interesting about the physiology of everything. Just know that in an effort to repair itself by creating new liver cells, the liver may become enlarged, which is known as hepatomegaly, which is like causes another set of issues. And then with cirrhosis, it's usually because of chronic long-term alcohol abuse is the most common cause of liver failure, cirrhosis, ascites, and esophageal varices. So alcoholism can be a huge bad thing. So signs and symptoms, low-grade fever, weight loss, the bigger the belly, the abdominal girth, you're going to see the jaundice, everything that goes with it. So usually, like when you're monitoring them, you're going to do a number of LFTs, liver failure tests are usually done to monitor the extent of the condition. Treatment for liver cirrhosis aims at helping the liver repair itself to maximize liver function. It extends over a long period. In the client with liver failure, at least 2 months are needed before improvements can be noted. The treatment goal is to stop or delay the progression of symptoms. So just know that for liver failure, their diet is high in vitamins, moderate in carbohydrates and fats, and low in sodium. The amount of protein depends on the liver's functional level, because that protein is a waste product, so because the ammonia can build up from the waste product of the protein. Okay, so position, so when it comes to like the big belly, the 13-month pregnant person, positioning them so they can breathe easier and function better is really important. Let's see here. So hepatitis is an acute or chronic condition of liver inflammation that also may be accompanied by liver tissue damages. Viruses are the most prevalent causes of hepatitis. So there's a handout, really nice and handy, this one right here, that talks about the different hepatitises. So usually you have A, B, or C, and those are the ones that you're going to see, but the book also talks about D and E, and there was even one called Q when I was going to nursing school. I don't think the book talks about it. No, so let's do a quick thing. So A, B, C, D, E. So A is fecal oral, which means you're gonna get it from contaminated things. Little kids usually get it just from like playing in the playground and putting things in their mouth. Fecal oral, it usually goes away, let's see here, after like 4 to 6 weeks. So 4 to 6 weeks, bye. It is viral and it causes some issues like abdominal pain and things like that, but it resolves it on its own. Who knows, you could have had hepatitis A and not even know about it. Hepatitis B is usually associated with like sexual transmission. So anything with like blood and body fluids is a big reason why people get this. That's why as a healthcare worker, it's important to obviously be very careful with your patients. Treat everybody like they have the disease so you don't get anything. And they recommend the hepatitis B vaccine. They recommend giving it to children as soon as they're born. I don't know, is that necessary? It's tons of ethical questions about it, but I didn't get the hepatitis B vaccine until I started working in healthcare, and I don't have hepatitis B. So it's up to you. There's a big push in vaccines, blah, 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 blah. We can get into that later. Anyways, though, hepatitis B, it can be in your body for a long time. Let's see here. So after exposure, so usually IV drug users, that's a big thing. Let's see here. Blah, 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 blah. You can give it to your child if you have it when you're pregnant. So give the vaccine. So there's a Hep B vaccination. Get that if you're a healthcare worker. The incubation is 60 to 110 days. So that sucks. And then, so recovery and resolution of HBV, hepatitis B vaccine, infection occurs in all but approximately 17% of infected people. So 83% of the people recover. So 83% recover, whereas almost 100% for this recover. 83% recover. So yeah. So it also increases your risk of liver cancer. Increases risk of liver cancer. Okay. Hepatitis B, don't get it. Hepatitis C, it was a big thing back in the 80s maybe, when it was all the prisoners are getting hepatitis C because of the sharing of needles. So, let's see here. So IV drug users and individuals who received blood products before changes in laboratory testing. So, contaminated needles was a big thing back then because they didn't clean the tattoo needles. And even the general population would get it too. So it's usually IV, blood. But a lot of the time it was IV or needles is why you got it, hepatitis C. So in that guy, you can recover from it, but usually a lot of the people don't. So half of all people newly infected with hepatitis C will become lifetime carriers of the virus. So that really sucks. So it's a lifetime thing. So lifetime usually. And there's no vaccine. No vaccine, and they're good candidates for a liver transplant. So they're usually the ones that will get that liver transplant. So hepatitis B is associated with hepatitis B. So this guy is with Hep B. Usually we'll get it from that. And there's no vaccine. Then you have hepatitis E. It's also the oral fecal route. So you put something in your mouth and you might get contaminated. It's an acute infection. It does not develop really chronically. And then you'll have a lifetime immunity. So it's acute and then lifetime immunity. So again, let's reiterate things. Hepatitis A, fecal oral route. It goes away in about 4 to 6 weeks, usually 100% recovery. Hepatitis B is usually that blood, body fluid, semen, vaginal fluid. So it's usually associated with the whole STD, protect yourself. Or IVs. Incubation is 60 to 110 days. There is a vaccine. They recommend getting that if you're a healthcare worker. There's an 83% recovery rate from it. It increases your risk for liver cancer. Hepatitis C is usually associated with the contaminated needle or tattoo, you know what I'm saying? Like the whole thing was a big deal back then. Usually you have it for a lifetime. There's not really any recovery. There's no vaccine, and you're a great candidate for a liver transplant. Hepatitis D develops from hepatitis B. Basically, you'll get it, and there's no vaccine. Hepatitis E, the oral fecal route, same with hepatitis A. It's acute, and it's a lifetime immunity. These two guys are rarely talked about. So these A, B, and C are the ones that you should be aware of. Always, if you have a patient that's positive for Hep B or Hep C, it's just good to pass it along just so people are extra careful. You should already be careful, but it's always nice to just be extra careful. You don't want to get it. So then again, so basically when you're taking care of hepatitis patients, supportive rest and care while monitoring liver function and electrolyte balances is necessary. Have them rest. Their body's going under a lot of stress from this whole viral infection. So too much activity too soon is likely to bring on symptoms, such as like the whole exacerbation of like the hepatitis can happen, which is like weakness, jaundice, everything that goes along with that, whatever, blah, blah, blah. Anyways, though, so closely observe standard precautions when caring for clients with hepatitis. Warn clients never to donate blood if they have ever had a Hep B or Hep C infection. The virus can be present in the blood and body fluids for an entire lifetime. So even though they recovered, it can be present. Okay, so liver abscess. Liver abscesses are caused by the spread of infection from some part of the intestinal tract, perhaps the appendix or gallbladder, or by obstruction of the bile tracts. So abscesses, like I said, it's like that big nasty zit in your body. Blah, blah, blah. Symptoms are chills, fluctuating temperature, extreme weight loss, nausea and vomiting, abdominal distension in the ascites, and right-sided pain in the abdomen and shoulder. So again, your liver is on your right upper quadrant. Jaundice occurs frequently. Jaundice is the yellowing of the skin. Google it and you'll know it forever. If the abscess bursts, it scatters infection through the abdominal or chest cavity. Antibiotics are given, and the outcome depends on how successful the person is at combating the infection. Sometimes an attempt is made to establish drainage by surgery. Standard precautions help prevent the spread of infection. So knowing if there's something going on, get them treated right away. Hopefully that will not burst and prevent all that from happening. Trauma. If that liver gets injured, is highly vascular, it can bleed, and it can cause hemovolemic shock because the liver is such a vascular organ. So signs and symptoms of that are you're going to have orthostatic hypotension, low blood pressure, tachycardia, and shock. So know this right away, get them into surgery, get them to stop that bleeding as soon as possible. Okay, liver transplantation. It's basically what it says. The transplanted liver may be a total replacement or a liver segment. Great. Liver cancer. Usually, the liver is rarely the site of the primary cancer. It's more often the cancer of the liver is metastatic. So that means like you've had cancer somewhere else and it's going to travel into your liver and metastasize. It's rarely the place where liver cancer happens unless you have hepatitis B, then you're at increased risk. Okay, great. So that's the liver. Very vascular. Different viruses that can cause the hepatitis from happening. Usually you're going to see ascites, the big belly, and the yellowing of the skin, jaundice. Disorders of the gallbladder. You have cholecystitis and cholelithiasis. So, cholecystitis is inflammation of the gallbladder, and cholelithiasis is what is the gallstones, the stones in the gallbladder. Okay, just know, a nursing alert. I'm on page 1611, by the way. Strenuous dieting and rapid weight loss can precipitate a gallbladder attack or the formation of stones. Lack of fat in the diet causes bile to pool in the gallbladder because it is not needed for fat digestion. So, again, like they say, rapid weight loss, anything like that can cause those stones to build up in the gallbladder, which can be really painful. So, signs and symptoms is sudden onset of acute pain. Indigestion, you're going to have what's called steatorrhea, it really is like light colored poo. It's like clay colored. Look at the picture up on Google, you'll see it and you'll be like, oh, okay. And then you have nausea, vomiting, eructation, belching, fever, jaundice, and malaise. So that's generalized weakness. So if they've had like light colored poo and they're having acute abdominal pain, it could be an indication for gallstones. Sorry. So they also, what can happen is that you could have, sometimes the infected gallbladder fills with pus. So then you have empyema of the gallbladder and may rupture, causing peritonitis. That's another reason to always get things checked out right away. So the diet is restricted to non-fat foods when you are treating this. So stay away from anything that are greasy and fried. Dang it. Alcoholic beverages are contraindicated. So morphine should also not be used because it is believed to increase the spasms of your abdomen that could be going on with it. So surgical procedures, there's all kinds of things. Usually it's like, just look on page 1611 in the top right. You have a cholecystostomy, opening and draining the gallbladder, cholecystectomy, removal of the gallbladder, choledochostomy, incision into the common bile duct, and choledocholiothotomy, incision to the duct and removal of the calculi. So just because they remove calculi once doesn't mean it can happen, like it can happen again. So that means like it could happen the entire lifetime. And if it keeps happening, they might just remove the gallbladder right away, or just remove it because it's just like you're not going to keep going in and in and in to get it out. So when it comes to abdominal surgeries, they usually can just like do laparoscopic. So they just like make little incisions, and usually one of them is through the belly button, which is really awesome. But they also have to like fill the belly a little bit with air so they have a better visualization of what's going on. And so people are going to come out bloated, uncomfortable, and they're not going to want to take deep breaths because any pressure on the abdomen is going to put pain on it. So it's really important that you help them turn, you help them kind of relieve that pressure, get them to use the incentive spirometer. It really helps them take those deep breaths. And then just get them up and moving, because that will also help with like the passage of things in their body, like getting the air out, moving their bowels, helping them just regain their previous functionality. Sometimes they also will put in like little drainage tubes. So for anything with like a cholecystectomy, they'll put in what's called a T-tube. And there's also things called Jackson-Pratt drains. They have all kinds of little drains, but a T-tube is basically just like a little bag that connects, and then it's just going to collect any sort of drainage going on. So instead of it draining inside of the body, it helps just drain it out. And your job is to monitor that, check for any abnormal drainage that was been going on, and document how much is going on. And after a while, it's going to stop draining because it doesn't need to drain anymore. And so then that's when you clamp the tubing for a day or two, see how it's going. And if it looks great, then they'll just go back in there and they'll just take it right back out. It's super awesome, super slick, and it helps with like decrease that swelling of the inside of the body. It just takes that swelling all the way out. Like it just gets rid of it. It just helps it drain into a bag outside of the body. So just Google a picture of like a T-tube and a JP drain, and you have an idea of what's going on. Really slick. Okay, so, and then let's see here, blah, 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 blah. Disorders of the pancreas. I'm on page 1612. Pancreatitis is inflammation of the pancreas. It may develop from infections or traumatic damage, alcohol, or drugs. So, I have my cousin's husband sometimes gets this, and it's usually probably because he's just drinking a lot of beer. So anyways, though, it can happen suddenly, and it's not fun, and it can happen over and over again. Signs and symptoms. Intractable pain in the epigastric area that may radiate to the back or upper left side. Fever, anorexia, nausea, and vomiting are common. Jaundice may exist if the common bile duct is obstructed. So just a heads up, if this pancreatitis can cause an obstruction, you can have jaundice as well. So treatment includes analgesics to relieve pain and spasm. The prescribed diet is low in fat and high in protein and carbohydrates. And it kind of just like goes on about different types of treatment. And then unfortunately, you can also get what's called pancreatic cancer. So tumors of the pancreas are usually malignant. Cancer of the body or tail of the pancreas is usually not detected until metastasis has occurred. The client's prognosis is poor. Unfortunately, if you have pancreatic cancer, you're really not going to recover very well, or if at all, and they find out too late just because it doesn't show up right away. So just a heads up with that. So just know that a lot of the time it's pain management and just supportive services for you and the family. Okay, so then it talks about obesity. So obesity is basically overweight, excessively overweight. We'll just be dramatic and call it 600-pound life. So that's a sign of obesity. And unfortunately, more people are becoming obese, which is leading to a lot of medical conditions and factors that could just go away if they just ate a more healthy diet. And so, so let's just see here. So obesity is a contributing factor to many medical and surgical complications. So you have cardiac diseases, hypertension, heart attack, stroke, anything like circulatory. They can also develop what's called hyperlipidemia, which is excess fat in the body, or in the blood, I'm sorry, develops and fat is deposited in the liver, so you would call it fatty liver, just things like that. Like all kinds of things can happen just from being obese. So the best thing to do is just helping them understand what they're doing to their body and encouraging them to just eat a better diet and to just take better care of themselves. It's hard, it sucks to like have that conversation, but sometimes if you just like, this is what's happening and the best way to prevent it is to simply change your diet, change your lifestyle, usually they'll go with it. Okay, so, but something to remember, this nursing alert on page 1613. Weight loss programs requiring ingestion of large amounts of water may be dangerous to the person with glaucoma. It may increase intraocular pressure. So, or certain kidney or liver disorders. The nursing mother should not be on a drastic weight loss program because toxins and pollutants, which are stored in fat tissue, enter the mother's blood and can pass to the baby. So again, those big fat cells that are happening when you're obese, those are storing the toxins and pollutants from anything you're eating or drinking or smelling or breathing in. And once you get you decrease that size, those get squeezed out and go into your bloodstream. So you might feel really weak and tired when you're losing weight. Obviously, it's because of everything that you're doing, but that's also another reason why. So, and then different things, this Nursing Care Guidelines 88.4 talks about taking care of them in the hospital. The most important thing that you can do as a nurse when you're taking care of an obese patient is protecting your back. They are heavy. They're not easy to move. It is okay to ask for help, and it is okay for them to just wait another 5 minutes to go get someone to come help you transport or move them. If you have any devices that can help you pick up a patient or move them, use them. They're designed to protect you. Your body is your work. Like, you need a good back, because if you don't take care of yourself now, you're going to feel it in 5, 20 years from now when you're still wanting to work and be professional, and it's just going to be awful. Protect your back. I can't say it enough. Okay. And then it talks about exercise being helpful, and then successful weight loss will take time. Just tell them it takes time. You'll get better. And just give it time. Give it time. And then it talks about anorexia nervosa and bulimia. A lot of the time, unfortunately, when it comes to these disorders, it can be psychological, and there's a huge sign and symptom list on page 1614 that talks about that. So just giving them like the encouragement and the patience and the support that they need to overcome these disorders, they usually can. So again, anorexia is just basically self-imposed starvation, and bulimia is the binge syndrome. So there can be someone that just doesn't eat and then just eats a ton and then doesn't do anything about it. And then they're usually overweight as well. Or you have the purge bulimia, which is they'll eat a ton of food all at once and then try to vomit as much of it out. And they usually have really bad oral health because all of that gastric content, the acidity, is just ruining the enamel. It's giving them bad breath. Just like you can just kind of tell. So, and they, like I said, it can all be life-threatening. Anorexia, bulimia, and obesity can all be life-threatening. So just giving them time again and help. And then just letting them know, like, hey, you doing this is really disrupting a lot of the other body systems, like other conditions in your body, such as anorexia can cause like hair loss and hypotension and just like bad skin health. And then bulimia can just have that bad oral cavity health. So education and time and patience and encouragement and supportive behavior is usually sometimes the best things you can do to people. Okay, and then that's pretty much it. And then pages 1616 and 1617 talk about how to place an ostomy appliances, irrigating the NG tube, and things like that, which hopefully you're going to go over in lab. So if you have any questions, please let me know. You guys did great. I'm sorry I had to divide the video into 3 sections. And Anyways, though, again, yes, you as a nurse, it's very important to take care of yourself and to take care of yourself both physically and mentally. So it can be draining to help people, very draining. So it's important to just not put any sort of like too much pressure on yourself. Find someone to have an outlet and talk to, because that can really help you as well. Okay, let me know if you have any questions. Thanks, you guys. Bye.